Hi, I'm Mr Shyamalan, consultant hand surgeon, and I'd like to talk to you about injections around the hand and wrist and elbow. Injections essentially form into two groups. You can have either injections for pain relief, such as steroid injections, or injections trying to regenerate the area, and that could be your own blood products. So first I'd like to talk to you about platelet-rich plasma and autologous blood, which is your own blood, where we take out your blood from the arm and we spin it in a centrifuge, and the platelets, which is the healthy tissue in blood plasma, we inject back into a certain area. And the analogy I give is, let's say you fall and you cut your leg and you get a scab as it heals. That's the platelets that cause that healing and regeneration. Eventually the scab lifts off and there's nice healthy tissue. And the principle is pretty much the same with platelet-rich plasma, where we take those platelets and we inject it around an area that has a poor blood supply or a poor tissue area. And as that regenerates and brings in those healing properties, hopefully some of the pain and the inflammation will settle. Steroid works in a slightly different way, where you would take a non-steroidal anti-inflammatory drug like ibuprofen, which helps with pain and also settles down inflammation. And the steroidal anti-inflammatory is what a steroid is. And that just takes down the swelling, helps with the pain, but perhaps doesn't improve the tissue around as far as improving blood supply. But a lot of conditions certainly are improved by that. I would say there are pros and cons for each, and most of the time, 95% of the time, we use steroid. Like any invasive procedure, there's a small percentage of complications. Infection's very rare, but in those patients who are immunocompromised, we do warn them about this because there can be a slight drop in immunity. But generally most patients, even diabetics, tend to be okay with steroids. Diabetics do have a slight change in their diabetic profile, where I've advised them to check their blood sugar with a bit more regularity. The steroid itself can make the skin pale, and certainly in Asian or Afro-Caribbean skin this can be quite noticeable. And the fat layer which sits underneath the skin, sometimes that can atrophy or just disappear, leaving a slight hollow. Obviously the injection can wear off after a period of time, but generally I would say after the short discomfort in the first day or two, where you may have a small flare of pain, after a couple of weeks, 2 to 3 weeks, the actual pain relief effect of the steroid actually works. And steroid can be used in most joints, but we use it quite commonly in the hand and wrist to treat certain conditions such as carpal tunnel, trigger finger, joint arthritis, tennis elbow, golfer's elbow. So it's used quite widely. And I would say as long as you have looked at this, of the various things one can get from using it, I think generally it's quite safe.